Hello, friends and family. Thank you again for tuning in. It's a pleasure for me and an honor to be here. I'm your host, Dr. Valerie Mukanga. I am the owner founder of Healing Wings Dental, located here in Arlington, Texas. It's a dental practice where we strive to help our patients maintain or regain their oral health so they can soar in life. And so, like I said, we are located in Arlington, Texas, and it is our pleasure to see our patients, to help our patients address their issues. We do see patients of any ages, from 0 to 99, as we say, meaning like whatever the age is, we see you. And, it is our pleasure and our duty to help our patient. But here today, we are here because we want to discuss a subject with you. And what I would like to discuss is, in light of patient, some of the dental emergency types that they come to the dental office for. And I'm going to depict some point, and maybe like what causes them, and also somehow like what should be done about them. So many people, when they come, they pick up the phone and they say, I have an emergency. So yes, what's your emergency? I have a toothache. Well, a toothache, it's one of the reasons why a lot of people come to the dentist. And it's not very specific, because it can come, or it can be caused by many different issues. So the toothache is one of the things that people mention as of, one of the top one reasons why they come to the dentist. And another thing they come for is an abscess. An abscess, what is that? So an abscess is an infection that creates, the abscess. So many people recognize that they do have an abscess because they see a swelling somewhere. So it could be a swelling in their gum, or it can be so extensive that it can actually be seen, on the face. And the swelling can either be soft, or it can also be like a more harder. When you do a palpation, you feel that the area is hard. And so oftentimes when you see an abscess, or you actually see, that the person's face is swelling, that means that, usually there is like a separation or pus that is built up there. And so that's another type of reason, another causes why people come to the dentist or call and say that they have a dental emergency, and they want to see us in the office. So the reason, what can be done about an abscess, is that you definitely want to go to a dental office. You want to go see a dentist so that can see, what is actually causing this abscess, and treat you accordingly. So you want to refrain from, using your mother or your brother's, medication, antibiotics, because you don't really know, you know, um, first of all, what is causing it. And then also, sometimes while you're using that, the key question that I usually ask myself is, why is it that your sibling or your friend or your parent still has this antibiotic that they didn't finish, you know? Um, so, yes, you definitely want to not self medicate. You want to actually go to a dentist and see a resolve on the issue, because there are, some abscesses which can be lie on some areas. Say, for example, if it's in the floor of your mouth, and you know it can actually impede on your airway, and that can be very dangerous. And so you want to go and have a dentist actually assess, diagnose, and treat the problem. So an abscess is another reason. Now, you also have some people who have some teeth that are loose. They're calling because they say, I have this one tooth that is very loose, and it's causing me great discomfort. That's another reason why people come stating that a call and state that they have an emergency. So in those cases too, tooth tooth movement or mobility can be caused by many different things. So it can also be non-truly specific. But one of the major reason why people have loose teeth, besides being children and just, for it to be normal because they're about to lose the tooth, but if it's a person of an adult age or older, or someone who actually have permanent teeth, usually it can be caused by periodontitis. Periodontitis, which is really an infection of your bone, the bone that supports the teeth. And so now, because you have lost so much of that bone, and the area is infected, you start having teeth that are loose or mobile. And so that's another reason for that too. You want to, the common response will be to go see a dentist, because there is instances where things can be done to save the tooth or save the teeth that are mobile. In some instances, you might not be able to save it and the tooth will need to be removed, but there are definitely ways to actually restore the missing teeth area. Another thing that can happen would be a chipped tooth. A chipped tooth can actually, depending on the severity of the chip. So you have different classes. We say class 1, class 2, class 3. Ellis fracture teeth or chips. Chips usually, oftentimes they don't really cause pain, but if you have chipped it in a to the extent that it actually involves the area under the enamel, which is the white surface of the teeth, it can actually start causing you pain. And so with that too, you want to definitely go and visit a dentist, because and actually have it treated, having the tooth assessed and treated accordingly. In some instances, you may need a filling. In some instances, you may, be able to resolve the problem by a veneer or sometimes a crown, depending on the severity of the chip. There's another thing that can happen, and it could be that you have lost your filling. So you have fillings, or you have a filling on your tooth and actually it comes out, or even a crown that has been dislodged, or you lost a crown. And also with that, say for example you lose a crown and you didn't have a root canal, well, the area that is exposed is actually going to be very sensitive, and so it can actually cause you pain too. So yes, so that's another thing that people come for, stating that they have an emergency. For that too, you want to come to the dentist. We will assess and actually treat the condition accordingly. Another thing would be a cracked tooth, and it's similar to a chipped tooth, but it's more extensive. And with that too, you want to come and have that assessed, because there are some cracked teeth where the crack has not really gone all the way down to the root, and something can be done. You may be a candidate for a crown, or something else. Perhaps the crack is so involving that the tooth actually has to be removed, and you can always have it restored by either an implant or a bridge, or yeah. So that's another thing that causes people to come. And many times, many times, I've heard people say, "Doctor, my tooth is cracked." And I say, "Well, when did it happen?" "Okay, it happened, 2 days ago, and or yesterday, or just right now." And I said, "Well, what were you doing?" "Doctor, I was just eating a salad." And so really, like, in many instances, people don't realize that they had a chronic problem that caused this tooth to crack. It's not likely that you just eat a salad, or you're just eating some rice and all of a sudden your tooth cracked. That truly means that you already had an issue. For the most part, you had maybe a cavity that was progressing so slowly that you didn't really feel pain, and so all of a sudden you're eating your salad and something cracked. It's just because you already had a problem. But a tooth can also crack for different reasons. It could be chewing ice, or you could be you know actually trying to open a bottle of whatever it is. I don't know if it's a bottle of beer, a bottle of something, with your teeth. And yeah, your tooth can crack that way. So you want to be very, very careful to not really chew on things that are not, that's not food, because, it can be, it can actually crack your teeth. And yes, that would be an emergency. You could also have an accident, and that's a true emergency, because say you have a car accident or you slip and fall, and you can either, with that accident, either maybe break your jaw, or knock out or a tooth gets knocked out. And so when you have a jaw, you actually say you have an accident, your jaw fractured, it is not for you to go to a dental office to go and get evaluated. That's an emergency that you want to definitely go to a hospital for. Because you see, many people go, to the emergency room because of a toothache. Many times, especially here in the US, they don't really have, dentists or general dentists that can actually address your problem. Oftentimes, you'll be given some pain medication, you may be given some antibiotics, they will still send you to a dentist. But if you have a jaw that fractured, you have an accident, you slip and fall, you definitely at that point want to go to the emergency room. But say, for example, you fall and your tooth gets knocked out, or your child is playing and the tooth gets knocked out, what you want to do is, if you can find that tooth, you definitely want to get the tooth, ideally put it in some milk, and then find a dentist as fast as possible. Hopefully, it's something that happens during the day when offices are open, and you can actually bring it to the dentist and something can be done with it. But if you don't have milk, just take the tooth and actually bring it to the dentist, because there are many instances where the tooth can be reimplanted, placed back in the socket, and then we will actually stabilize the tooth, and then you can end up still functioning with that tooth. So those are some dental emergencies that people call for. And as I said, for many of them, you definitely want to come and see a dentist so that they can actually diagnose the problem, and then find a solution for you in a very timely manner. There are many people who come for emergencies that had actually happened from a long time. We asked them, how long have you been experiencing this pain? Well, doctor, it started 2 months ago, or maybe 6 months ago. You really don't want to, wait that long, because, you definitely want to have the problem addressed and treated as soon as possible. But if it's an emergency, something that just happened, like you just cracked a tooth, or, those are true emergencies, and you definitely want to have those assessed as well. So I know I mentioned many situations that cause people, to call the dentist. And honestly, the true thing is that, you definitely want to call a dentist and a dental office and have the issue taken care of. That would be the solution of most of the situations that people call for. But we always advocate, for people having a routine, checkups, because many of these dental emergencies can be either prevented or treated early. It's kind of like cancer, where, early detection, the earlier you detect the problem, the better it is. And so, yeah, that's really our advice for you today. So, if you have further questions, or if you have a story to share with us, we would like to hear from you. If you have a question, we would like for you to ask your question for us, and we will be gladly be here to answer them and provide you for more insights. And if you don't have a dentist that you know, please don't hesitate to contact us. Like I said earlier, we are Healing Wings Dental, located in Arlington, Texas at 4101 West Grinnell Boulevard, suite number 317. And our zip code is 76016 here in Texas, in the Big DFW area or Dallas Fort Worth area. You can also give us a call at 972-213-0202, or you can request an appointment here on our website at www.healingwingsdental.com. And you can find us on social media by typing Healing Wings Dental, and we can be found either on Facebook, on Instagram, on LinkedIn, or YouTube, where you can find more insights as far as your dental concerns are concerned. So I really want to wish you a great day. Thank you for watching. Please don't hesitate to subscribe to our channel, follow or like us, and also to share it with your friends and family that would also benefit for what we shared with you today. All right, so have a great day and be blessed, and make sure you keep your day positive because it is within your power. Be blessed and have a great day. Bye bye.